Well, I am not terribly concerned about the doctor-patient ratio because I don't have the statistics. What I'm more concerned about is the way doctors handle the concerns of patients, particularly in general hospitals. I feel that they need training on communications. They have to be polite. I've been to general hospitals twice with a friend of mine and members of staff of general hospitals. I'm not referring to everyone because that would amount to a fallacy of hasty generalization. I'm talking about a substantial number of the members of staff of general hospitals. They don't treat patients with politeness. They don't treat patients politely. They have to work on that.
There's not enough compared to what I've been seeing in outside world, outside country. There's not enough. Number one, the population of Nigeria, there's a population of Nigeria. We need more doctors. If you take a look at the way they are doing things in outside country, government is already there for them in anything. Maybe in terms of money, compared with here, people don't have. Many people die at home because of no cash, no money. You understand?
So do you think we have
So
enough doctors to treat?
they don't have. There's not enough doctor because many doctors that have even been training here went outside here because of money.
Okay.
You understand?
I don't think so. Why? Because I don't know if it is because don't have enough of them that so many people traveled abroad for treatment. If that be the case, it means we don't have enough doctors around.
I really don't know what the database is saying right now, but with the number of doctors passing through the universities every year, I would want to think we should have enough doctors capable of running the whole country. But the system, the facilities in the country may not be adequate enough for these doctors to work efficiently.
Okay, I think government have enough to do about it. I'm talking about the public government hospitals. Like last week, I was listening to news and a doctor was talking about not being taken care of in one of the university teaching hospital. That they are not being taken care of them. They don't give them anything. They lack so many things. And in a situation like this, I don't think if someone will want to go into such practice where they are not taken care of. So I think the government need to take care of the doctors in the hospital and even the private ones. Because if you are a private hospital owner, I mean, you need to take care of your workers very well so that they will discharge actively.
You've been talking a lot about the crisis we're having in the country with the doctor-patient ratio rather. So how did we get here?
We got here because of who we have developed into. Very selfish people, very unpatriotic people. Except we put nation first before self, we ain't going anywhere. Over a period of time, there was infrastructural decay and nobody cared. Over a period of time, there was economic downturn and nobody cared. It is a multifactorial thing, but the major reason why we are here is greed and corruption. Corruption, not only corruption in the cloth of the nation, but every fiber of the fabric of this nation. That is why we are where we are. Because we do not see others as part of us. If we see all ourselves as brothers and sisters and cared a bit more, I believe Nigeria would have moved on much better than where we are now.
Hold on, Dr. Owa. We'll be talking about the consequences of how we got here. We'll be right back after the short break.
It's very encouraging and inspiring to find that a show as a physicians exists to put focus on the issues of health, especially as health has been given a backseat for a very long time. I encourage you to please watch The Physicians. Don't ever touch that dial.
Yes, Dr. Owa, well spoken. Infrastructure, poor remuneration, and you said something that is very important and very touching. Except we put nation first, we are not going anywhere. I can imagine what is actually happening. 1 doctor to 10,000 patients. So what happens in the rural community? I know you have traveled around this whole country. Can you just share your experiences with us? What do you think is going on now? If those of us in urban areas are suffering like this, so what do you think is happening in the rural communities?
Frankly speaking, in the last few years, I've been to the 6 geopolitical zones, even the Northeast, even IDP camp. My heart bled when I was in IDP camp in Yola. It saddens my heart that the bulk of Nigerians live in the rural areas and they do not really have access to healthcare. It's bad. They are Nigerians like every other Nigerian. No Nigerian is more Nigerian than the other. Something needs to be done. Our health indices are very low, and we are talking about getting better economic indices. I bet you can never improve on your economic indices without good health indices.
But with this now, can we actually achieve the universal health coverage?
For all?
For all. Because that
the answer is
the new thing.
N-O, no.
Oh, wow.
Right now, even with the coverage of national health insurance is below 5%.
So maybe in the next 30 years, we won't be able to achieve this?
If we put our mouth and our heart and our money to it and have the can-do spirit, we'll do it.
Okay, let's. Nigeria, if we have the can-do spirit, and I know that Nigerians are like that. We never say die.
If
we never say no.
If we can do it in sport, we can do it in health.
I totally agree with you, Dr. Owa. We have that spirit of unity.
Please, I beg politicians, for the love of country, put nation first. Help improve the health indices of Nigeria so that we can improve our economic indices and make Nigeria a better place.
So we've all heard from our guests the issues about the doctor-patient ratio in Nigeria, the consequences, and of course, some solutions we should be looking at. But I want to throw this $1 million question to you out there. As a patient in the community, whether on the urban or the rural, you are among the 10,000 patients out there that is assigned to 1 doctor in Nigeria. How does that sound to you?
Yes, how does that sound to you? Is it doable? 1 doctor to over 10,000 patients? We know very well that Nigeria can surpass that if we put our hearts together. Infrastructural development, remuneration of doctors, and of course increasing the retirement age like our own guest actually said.
We've heard a lot about the consequences, the issues regarding doctor to patient ratio in Nigeria. And of course, our guest has done quite a lot on the justice, on the solution that we should look at on all tiers of government. But we'll be seeing you next time.